Welcome back to NxHLife, where chronic pain sufferers rise as pain warriors and take back control. I'm Antony Lung, physiotherapist, nutritionist, and functional medicine practitioner. Today, I want to talk about something that could fundamentally change chronic pain care in 2026. Not a new drug, not a new surgery, not a new exercise. It's artificial intelligence, AI. It's about to transform chronic pain. But if you use it the wrong way, it could actually make things worse. And this video is your pain warrior guide to using AI wisely, not blindly. Okay, the wake-up call: AI is not therapy. We are entering a moment where people with chronic pain will split into two parts. And I need to be very clear about something. Some people are already using AI as a psychological or emotional support. They're talking to it like a therapist, processing trauma with it, seeking reassurance from it. This is a big caution. AI is not built to treat psychological distress. It doesn't replace therapy. It does not replace human connection. And it does not understand trauma the way a trained human does. Using AI this way can increase emotional avoidance, create dependency, distort insight, delay real help. Here's the distinction every pain warrior must understand. AI should never treat your pain or emotion. AI can help you recognize patterns if you give it the right data. AI is a mirror, not a healer. A map, not a journey. A tool, not the treatment. People who confuse those roles in 2026 will get hurt. And people who use AI wisely will gain clarity the old system never gave them. Let's talk about the uncomfortable truth. Chronic pain is still treated in one of two broken ways. Atomistic model of pain is broken into parts. Treating this, treating the nerve, treating the joint and muscle, each part treated in isolation. When it doesn't work, patient are told, the scan looks normal. There's nothing structurally wrong, or just manage it with medication. Second uncomfortable truth, the psychologizing shortcut. When the atomistic model fails, something worse happens. Pain quietly becomes stress, anxiety, fear, catastrophizing, central sensitization, all unspoken, a psychological flaw. Pain is either a broken body part or a broken mind. Neither sees the whole human. This is why AI entering healthcare is dangerous if it simply automates outdated models. You don't fix a broken system by speeding it up. What the science is already showing. Modern pain science shows pain is multi-system and interactive. Stress and pain reinforce each other through overlapping neuroendocrine, immune, and nervous system pathway. Sleep loss impairs pain inhibition, increases neuroinflammatory, heightens pain sensitivity. Gut dysbiosis influences pain through immune, metabolic, and neural pathways, contributing to sensitization. Emotional load modulate pain via shared limbic and cortical networks. Chronic low back pain is associated with biomechanics and movement strategies too. Pain is not random, it's a pattern, and this is where AI becomes powerful. Not as a healer, as a pattern recognizer. Here's the key shift most people miss. AI is only as useful as the map you give it. If you don't understand your nervous system, your biology, your biomechanic, your pain story, what data to input, AI will simply reflect confusion back to you. But when you understand your map first, and then enter the data that actually matters, that's when AI becomes powerful. Step 1. Build personal pain map before AI helps. You must understand 4 areas: nervous system, safety versus threat, biology, sleep, inflammation, gut, energy, toxicity, etc. Biomechanics, load capacity, movement tolerance, psychology, psychosocial, emotion, trauma, and more. And altogether, your pain story. When pain began, life context and pattern. This context is everything. Step 2. Enter pattern level data, not just symptoms, or asking it just like Google. Pain warriors track sleep quality, stress levels, emotional load, food patterns, movement exposure, flare timing, recovery days. This is where AI shines, not diagnose, but cross-system pattern recognition. Let's give you some examples. Example 1. Nervous system patterns. AI may show flares after several high-stress days, pain spike following poor sleep symptoms, rising before awareness. This allows early regulation, not panic. Example 2. Biology and inflammation. AI may review delayed food flare response, accumulated inflammatory load, gut pain correlations, insight without blame. Example 3. Biomechanics. AI may highlight load spikes beyond current capacity, delay mechanical response, avoidance cycle. AI informs smarter rehab. It doesn't replace your physio. And example 4. Pain story awareness. AI may reflect on emotional overloading before flares, repeating themes in pain languages. This is not therapy. It's pattern awareness you take to a human professional. Critical line, keep this. AI doesn't heal pain. Insight doesn't heal pain. And awareness doesn't heal pain. Healing comes from what you do with that awareness, with the right human guidance. AI will not replace clinician, but it will replace the one-size-fits-all care, outdated pain models, symptom-only thinking. The future belongs to people who understand their patterns, respect their biology, rebuild movement capacity, regulate the nervous system, integrate emotional wisely. That is the pain warrior. If this helped you see the future clearly, hit like, subscribe, and drop a fire emoji below. Download my free guide, 7 Unspoken Truths About Chronic Pain Your Doctor Won't Tell You. Join the 5 Days Pain Breakthrough Challenge. I'm Antony Lung, and together, let's turn pain into peace one step at a time. See you next time. Bye.